The agenda, as usual, we've got a local COVID update from our Director of Public Health, Anna. We have a roadmap to reopening. Sam Walters will talk us through that. Changes to shielding, Pam Taylor. Emma Smith will tell us a little update about the COVID vaccine delivery, and then, as usual, space for questions, comments and feedback. So I'd like to welcome Anna Hartley. Over to you, Anna.
Thanks, Tracy. I've just come off the CMO briefing, so it's always really helpful when that happens just before one of these meetings. So it just means I have sort of all that up-to-date information. So just to talk a bit about the 7-day case rate, and again, sort of hot off the press from the CMO, in terms of the national picture, rates aren't particularly going down and they're not particularly going up. They're sort of fairly stable, which isn't surprising given that all the schools have gone back. So, and we have actually seen some increasing rates in sort of teenage children. Also, obviously the vaccination campaign is still targeted at cohorts 1 to 9. So whilst we've seen significant reductions in deaths and admissions, which I'll move on to in my slides, we're not seeing the impact of vaccination necessarily on transmission rates, which we will see when vaccinations roll down to that sort of lower age population. So whilst sort of no cause for celebration particularly, but equally no causes for concern. And in terms of the tests that were set by the government around continuing on the roadmap, they were things like hospital admissions, deaths, vaccine effectiveness, vaccine rollouts, and infection rates. There's no reason why we won't continue as planned, certainly for the next stage of opening up the economy, around sort of, I know I'm delighted, I'm sure you're all delighted, around hairdressers, etc. And I know now, obviously, it's been fantastic, hasn't it, to be able to meet people in gardens, back gardens, and see bigger groups outside. So that's all sort of on track. Wakefield, I think I've looked at numbers again today, fresh off the press, they're about 135 per 100,000 today, so a little bit higher than they were a couple of weeks ago. Not which obviously I want them to go down, but I'm not overduly concerned. I think we know why that is. So just to give you a little bit of the context in West Yorkshire, and again, you can see the case rate there, and it's there or thereabouts today as well. Our case rates in our over 60s is much lower, so that's fantastic because our over 60s are a more vulnerable population. So you can see that number's gone right down and it is continuing to fall. And our positivity rate, again, I think I've talked about this, but you'll remember back in November it was around 20%. So for every 100 tests, 20 were coming back positive. Much lower now at 5%, and that indicates that we're doing enough testing, because we really need to ensure we're doing enough testing, because that's obviously what we take our data from. So you'll see that across kind of West Yorkshire we're sort of second, we're kind of second there, and we've often been at the bottom of that list. We're not at the bottom of that list at the moment, but hopefully we will be again soon. But those numbers are going up and down a little bit with other areas as well, so I'm not too worried. And if you want the jargon, people are talking about enduring transmission. That's the kind of jargon. So, and again, Chris Whitty sort of shared his view, which is very similar, which I think is what we would all agree with, is that for those communities that have higher risk factors, higher numbers of key workers, manufacturing jobs, not so much in Wakefield, but in other areas, sort of overcrowded housing, that they just have more risk of infection, and because of those factors. So it's not based on behaviour, it's based on those sort of complexities. So again, just to really quickly show you positivity on the left, you can see that's going down generally quite nicely, and we track West Yorkshire. And on the right, PCR tests, again, good numbers of PCR tests being done. Again, we're tracking West Yorkshire on that. And then of course we've got lateral flow tests. So next slide, please. You'll see those are our lateral flow tests, so you can see how those are very high, and any of you who've got school age children will know that a number of that teachers are doing them, and also secondary school pupils. So this is an interesting graph in terms of age rates. You can see that 13 to 17 age rate has had that big jump up in numbers, certainly in terms of tests. So those are our test rates by age group, and that's really just reflecting the lateral flow tests. And although we've not picked up that many through the lateral flow tests, any additional ones that we pick up will make a difference to our case rate. You can see that with our other age groups, it's remained fairly static. And again, just to sort of, we look at these slides because it's important that we understand particularly the case rate in our older population. We need that to be as low as possible because those communities have lower outcomes. And again, you can see very sort of heartening really in our 80 plus age group, really low. You'll know that our vaccination rates are exceptional, so that really reflects that. So, and you can see as always, I always show this slide, it always shows you the same thing. It's that working age population with high rates, and then you can see that sort of tipping into that 13 to 17 age group. And with COVID, what you tend to get is a quite, for once you hit adolescence, once you hit puberty, you get a very similar clinical picture of COVID to adults, and children potentially, you get a much, we don't seem to have seen as much COVID, so we would expect that. So again, the orange lines are your 17th of February to the 2nd of March, and your blue lines are the 10th to the 23rd of March. So a bit of a snapshot across those two time periods. And what you can see is that bump is moved downwards. So we've had higher rates in our younger age group than we were getting, and again that's probably reflecting, it's not just about going back to school. Schools are fairly measured environments, but obviously young people getting on, perhaps sitting next, I don't know what they're doing, they probably shouldn't be, but they'll be talking at bus stops and all sorts. So actually it with schools going back, it's not just what happens within the school setting, but there's other knock-on effects of that, people going back to work, etc. And we look at ethnicity because we know that there have been poor outcomes for Black, Asian and minority ethnic communities. So it's really important that we keep a really close eye on that. And we have seen those numbers go up. So we're doing a lot of well, this isn't a good example of it, but really need to sort of ensure that we're getting those key messages out to all our communities in appropriate ways, doing a lot of work on vaccination. So making sure that communities have the opportunity to get a vaccination and there are no barriers put in place. But you can see that's creeping up a bit, which is a bit concerning. So we need to keep a really close eye on that. So yeah, this is just to show you the difference between the PCR test, which is your classic test, which we're used to doing, the lateral flow test, which we've talked about a lot, and a new, and you can see that whilst PCR tests are coming down, those lateral flow tests are going up. And you'll know as well that if you had a lateral flow test in a school setting, you didn't need to get a confirmatory PCR, but you do now. So we're likely to see those PCRs go up as well next time I show these slides. Next slide, please. Yeah, I won't dwell on this. I'll show it to you every time, just pretty much showing it's going in the right direction in terms of, we're not seeing those big darker patches which show higher rates of infection, but, fairly evenly spread across the district, nothing particularly concerning there. And again, just keeping an eye on deprivation. So we want to make sure that within our deprived communities that people have the same access to testing as it is in all our communities. So just to show you we're keeping an eye on that. I'm going really quickly because I'm mindful there's like loads of good speakers today and I don't want to take up too much time. Next slide, please. Yeah, and again, I've shown you this before. I just like to show you it for consistency. Again, you can see those big purple bubbles around workplaces, which just confirms what we know already, which is that lots of people in Wakefield district are in key worker professions, or they work in manufacturing, and that's just our population. That's how it is. Something to be proud of, really. But it does just mean that people potentially have more sort of places where they're at risk than people like who are just working from home the whole time. So this is a good news. This is showing you clearly how much our hospital admissions have reduced, and that's really around the success of the vaccination campaign and how vaccination does reduce those numbers right down. So whilst our rates are still high, the impact is significantly lower. So that's fantastic news, both for those individuals and families, but also for the hospital and health and social care system. And the same with deaths. So you can see we were getting about 30 deaths a week, and we're now down to sort of 8 deaths. And some of those, because people who are very ill with COVID tend to be in hospital a long time before, and often, before they die, what we would hope to see is those numbers reducing even further once some of the vaccination has kind of kicked in, because obviously it's a sort of 3 weeks before that work. I'll hand over now to my colleague Sam. I think is going to talk about the roadmap.
Okay, so what we've done is we've put together some slides that's going to walk us through the roadmap as has been declared by our government. One thing that we are conscious of is that what we'll say at the beginning is that our roadmap in terms of Wakefield Council goes a little bit longer than the June date that's been stipulated by government, and that is just to take account that we know that COVID may be hanging around a little bit longer. is subject to all sorts of variants, etc. So this roadmap that we're going to talk about today is very much aligned to the government dates that have been published. And what this presentation just works through is the risks and issues that we're flagging for Wakefield, the activities that we're going to be undertaking, learning from the past 12 months, and just going through it step by step in terms of looking at all of the above as a case-by-case basis. So next slide, please. So basically, as you're all going to be aware, and I know this is probably teaching you to suck eggs, but the 4 steps, so basically the roadmap that's been set out is looking at 4 particular steps for easing restrictions. And before proceeding to the next step, there's going to be an assessment of these 4 tests. So basically those 4 tests are that the vaccination deployment programme continues successfully, there's no interruptions, and obviously that it's working and you're picking up all of your communities. B, that the evidence shows vaccines are sufficiently effective in reducing hospitalisations, which you've seen from Anna's previous presentation. That appears to be happening in Wakefield, and obviously the deaths, thank goodness, are dropping. The infection rates do not risk a surge in hospitalisations, which then would put unsustainable pressure on the NHS. And that our assessment of risks, the government's assessment of risks is not fundamentally changed by any new variants of concern, and you've heard about those in the press, ones that keep popping up, and there's a worry whether they will interrupt any vaccination programmes, etc. So just looking at that, it takes around 4 weeks for that data to reflect the impact, and that's where they will look at that and then determine whether the next step can go as to plan. And therefore what they're saying is, whereas you will have seen a lot of the hairdressers have already said, and a lot of the outdoor hospitalities, they said, right, we're opening on the 12th, you know, we're out there, get the bookings in. It's indicative, it's no earlier than, and those dates could be subject to change. And that's just giving sort of the background to that. If the tests aren't met, we won't move to the next stage. So this slide show was put together sort of a few weeks ago when we were right at the start, and I do realise that we've moved a little bit along the roadmap, so you might have to just bear with us. But just in terms of risks and issues, we have had the concern, so it's almost a little bit like a fortune teller. So we kind of sat there and said, what might be our pressures? Warmer weather might create additional burdens. I don't know if any of you have seen, but obviously we moved along the second stage of the roadmap and got on Monday, and I don't know whether any of you have seen the national news or indeed the local news. We've had significant issues across the whole of the country, particularly in Leeds, but also in our local parks. Yesterday we had significant issues in Pontefract Park and at Pugneys, and I'm still getting that information that we've got similar issues today. We kind of foresaw that, so it's a little bit like told you so, but here we go. So warmer weather does create the issues. Every restriction lifted creates potentials for surges of cases, and that is because, just as Anna said earlier on, when children were released back to school, it released people also to go back to work who'd previously just been home-based. So you get children going back to school, you get people going back to work, and therefore you get people mixing, and therefore there is a risk there, particularly that we can get variants, etc. There's also that we have to take account of changing public attitudes, and one thing that we have seen in the last couple of weeks is we are now being challenged, our street marshals who are out and about in the community being challenged by people to say, you're not needed anymore, the vaccination programme's working, the roadmap's on there, what on earth are you doing, it's a waste of money. You know, obviously we've got to try and challenge those attitudes and say we're still in it, we've still got to keep continuing. There is message fatigue, there's complacency, just like what we saw yesterday and today, and because there is, and we've always got to take into account the changes in vaccine uptake, etc. And the other thing that we just flagged up really from the point of view of, and this was more from enforcement, but everybody who's been involved, which will be including everybody on this call today, is staff capacity and resilience, because everybody's been at this a long time and worked a lot of hours. And so then we're just looking at and raising that as a risk. Next slide, please. So basically our key activities that we're looking at as a whole council, and this is enforcement, the council, all council partners, public health, working with the police and everybody else, is that we ensure that businesses and sectors open a COVID secure manner in accord with the roadmap. At each stage along, the government has set out guidance and instructions for key businesses and sectors as to what they can do and what they have to have regard to. And we also ensure that we've got effective communications and engagements. And what we're trying to do is change those messages so that they mix between a line of proactive and reactive. So if we have issues like what we've had the last couple of days at the park, we've got to change to a more, you know, we need you to get on board, and a more strict stance, and perhaps encouraging people, you know, it's great, get back to the hairdressers and all this. Sometimes you've got to also throw in that we need you to comply kind of message. We also want to ensure that we're looking at our local infection rates, and given, like what Anna says, in comparison to the rest of the country, we are still quite high in Wakefield, and we have got to take that into consideration. Now, whilst the rest of the country may open up, and it may be absolutely fine down in Cornwall, for example, and their levels are quite low, if we find ourselves in Wakefield in a unique situation whereby we're still maintaining a higher, or we're just plateauing and keeping at the same infection rate, and we've got lower vaccine uptake, and we've got quite a few outbreaks, we may need to look at that. And there are powers out there which are called the number 3 regulations, and they give us powers to issue directions. So that may stop, it may close premises, it may stop events, it may ask us to close a market, it could ask us to do anything. If we had a car boot sale and we just thought it's just not safe for it to go ahead, we can use the basis of all the infection rates and the intelligence for us in Wakefield at that time and stop that from going ahead, even though as part of the roadmap it would be seen that it would be able to be open. We do have to still take that into consideration, and those powers are laid with us in the local authority to be able to manage that if we had a considerable concern with any business, or, like I say, event or activity that was taking part in the district. So what we just have learned from our previous relaxations, so when we've been in and out of lockdown, we have understood that enforcement requests do increase when restrictions are lifted, and this is expected to happen. So we've had the next stage along, we've now got enforcement requests. We're now being asked, can you put additional security on the parks? Can we put them on the tips? Because the tips were absolutely crazy yesterday. So we have to respond to that as we go along. We can try and foresee it, but actually until we get there and see what the demand is, quite often we're having to deal with this in a reactive way, which isn't great. We'd always like to be proactive. What we've also got is a huge amount of confusion, both for businesses and the general public, about what they can and can't do. And just for the last few weeks, we have been absolutely inundated across the council with numerous requests asking about, can I have my wedding? Can I do this? Can I run these clubs at Easter? Can we have this function? Can I have a team meeting in this building? Can we do this? So lots and lots of questions, because it isn't very clear. And the other side of it is that a lot of the information that's provided by the government and verbally said is quite often guidance, not regulation. So it can't be enforced. And I think the public, when they complain about a business or they complain about the next door neighbour, don't necessarily understand that the powers aren't there to enforce it. It's guidance, and there is no way of enforcing guidance. So whilst it's nice to be able to follow the guidance, it's not enforceable. And just to point out that what I would say is, from doing this now for the last 12 months, I would say that most of our businesses are COVID compliant, want to comply. They're as scared as everybody else is about returning to work. They want to get it right. But we do have a small pocket of individuals and businesses who just try and change or flout the rules to suit themselves, and will blatantly flout some of the rules, and therefore that's why we have an enforcement team that are there to address those situations. This was a slide that Claire put in, and it's very much just around just the reminder of giving the vaccine a helping hand, that there is a responsibility placed on people, and it was just very much around the vaccine circulating, and there's the chance that variants can develop. So we can probably bounce through these. So next slide, please. So this was 8th of March. We've already gone past this stage. We can go to the next stage, please. So we're on this 29th of March. This is where we've hit, and it's the rule for outside. The 2 households are the rule of 6. Basically, we're seeing what the outcome of that is. We're still getting lots of approach from businesses, but we have got some pressures within the district and across a West Yorkshire level, particularly when we've got young adults, and we've seen that in the chart that Anna showed earlier on, that they're the ones that appear to be carrying the infection. They are out, they are meeting it with friends in the parks, and we might see that continue to rise as a result of that. Next slide, please. So this is our big next day, is the 12th of April. So no earlier than the 12th of April, I will keep saying no earlier. If we can go to the next slide, please. So this is where we go from nobody being in the town centres other than small pockets of essential businesses that have been allowed to trade, to suddenly lots opening back up. So we've got non-essential retail, personal care, hairdressers, barbers, nails, beauty, public buildings, outdoor attractions, gyms, swimming pools, indoor, outdoor hospitality, and then there is some changes to the numbers that can attend funerals, weddings and commemorative events. The main point for this, and this is something that we're doing as a large team in Wakefield and with partner agencies, is that we are working on trying to understand which businesses are going to be opening in terms of outdoor hospitality. It would appear, because of the restrictions and because of the seating and the spacing, we're not going to possibly have a huge number of hospitality businesses opening on this date in town centres, but we certainly do have in the rural areas. So a lot of the pubs that have got quite large beer gardens, Rustic Arms being one example, have already set up 50 tables. They've got booking systems. They are quite booked up. You know, that they're where we are seeing huge numbers of potential people being put together. Now, we are working with those businesses on their risk assessments, trying to ensure where possible that they operate on a booking system, so we haven't got people chancing, going out, turning up. We're looking at their management, and particularly around pinch points, places like toilets, because at some point you can have 500 people, but at some point they're all going to want to go to the toilet, and is that going to be an issue? How is that being managed? How's the in and out? And is there any significant issues around there? One of the other concerns as well is that the government on reopening has offered each business the opportunity to open on longer hours, and they've done some manoeuvrability on the restriction of times. So basically Monday to Saturday, businesses will be able to open from quite early until 10 o'clock at night. That may increase footfall in our town centres, so it will allow places like barbers, hairdressers to open, and obviously some of our shops. Again, we're trying to get a little bit of information from our shopping centres, Ridings Trinity, Junction 32, all, Carlton Lanes, as to who's going to be opting for those longer hours, just so that we know that we've got footfall and can cover those areas. So again, I think I've covered most of these things, but we are looking at giving widespread guidance, trying to work with businesses to understand. We're also working with the public transport to understand how people are going to get into town, out of town, and that includes our taxis. We need to understand that, because whilst people may stagger coming in, there still isn't the number of seats on buses and trains because they're restricted for social distancing purposes. Is that going to create a problem at 5 o'clock when everybody wants to leave? They might have staggered coming into town, but what if they all want to leave at a certain time? And again, one of the things that we saw, and particularly around the town centres, is that the outdoor street cafe licences have conditions on them that they will have to close at 10. What we found last time when there was curfews in place was that suddenly you got a lot of people tipped out onto the street at the same time, and it became busy for taxis, etc. And this was more at the nighttime economy. So again, we're trying to work and see whether we need to do something in terms of planning, moving taxi ranks, where we start and end queues, etc. And obviously we're looking at that bank holiday on the 3rd of May, and we're stepping up for compliance and enforcement activities. I think that's it. is there any questions? Because the thing, just we move along with, I think there was a couple more slides, but just in terms of where we're going from here, we have got a full service team that are going to be set up. There's going to be street marshals, and we're currently in the stage of employment at the moment. We're going to have a large number of street marshals who are going to be deployed working in district areas and covering Monday to Sunday between 8 and 10 o'clock at night. They're going to be out there to give support to our communities and businesses on how to comply with the regulations, try and just give that verbal and reassurance. They're also going to be working with the Take 5 programme, which is where we've got people who may come into town and may have some issues or anxiety, and just give them a bit of breathing space and work with them. And then we're also on the recruitment for some more enforcement officers. I think we've got this in place now, and we're going to leave those people in place up until March 2022, so that we've got that cover for the district. Is there any questions?
I think you've done such a thorough job, Sam, that nobody's got any questions. But if anybody does think of anything, you're more than welcome to email the usual address, ccc@wakefield.gov.uk, and we'll pass those questions on to Sam on your behalf. So thank you very much indeed. And we've now got, I don't know if it's Pamela Taylor or Pam, which do you prefer to be called?
I'm Pam. Pam Taylor, yeah.
It's awful if people use your wrong name.
Oh, I don't mind, I answer to anything.
Hello, Pam. Thank you for joining us. Pam's the Customer Service Manager, and you're going to take us through some slides about shielding.
Yeah.
Over to you, thank you.
So I'll be looking down at my notes, so I do apologise for that. So hi everyone, thank you for inviting me today to talk to you about what the changes to the shielding and also the self-isolation support the government has now introduced. So guidance came out probably 2 weeks ago now, that actually placed quite a lot of pressure on local councils and also on the test and trace team to actually make changes ready for the 31st of March, which is today. So I'll start with shielding. So shielding paused for all CEVs, and now there's 2 cohorts of CEVs. So that stopped on the 1st of April, paused on the 1st of April. So that stops tomorrow. So all letters from government went out to all CEVs. They started going out on the 18th of March. So that told them basically what they could and couldn't do, and actually the fact that the support offer would be stopped. So all the support that's been put in place for the last 12 months has now been paused. Oh, we're here, so I can get back to it now. So it'll be paused, and it's been replaced just with practical advice, which I think has caused some concerns in terms of people, the number of phone calls we're getting about what does that mean for me. So we have seen an increase in calls since those letters have gone out. So the CEVs will be subject to the national restrictions, but their advice is to take extra precautions. So it says there, for example, shop at quieter times or get someone else in your support bubble to do things for you instead of relying on the local councils. Some support mechanisms will be phased out. So the supermarket schemes are now running until the 31st of June, rather than ceasing today. Funding for CEV stops today, but the big issue for us is the government expects us to be able to step up our provision should there be an outbreak locally or nationally, and we need to be operationally ready so we can do that very quickly. Sorry, I've got a tickly cough. So in terms of what's actually stopping, apologies if you already know this, so at the moment, the government have set up a new website whereby people can go on and nominate their support needs or identify their support needs. And one of those is access to supermarket delivery slots. These are available until the 31st of March, which is today. So up until today, close play today, anyone who is a CEV can go on the national website, update their needs in terms of supermarkets, and they will be given a slot. Those that have got the slot as of today will retain that slot until the 31st of June. But what's happening is some supermarkets are continuing to offer priority slots after that time. But that will be between the supermarket and the individual. So the council will have nothing to do with that anymore after the 31st. But supermarkets will continue to match the data that are on the system. So essentially, if I register today, I'm a CV, I registered today, but I don't create an account for a few days, the government and the supermarkets will monitor that and contact those people to see if they still want that, scheme. The DEFRA supermarket scheme, which is slightly different, that's for vulnerable people, not CEVs, will continue till the 31st of June. That's only 2 supermarkets, whereas the one from the NSS system, the 6. So, but the CEVs can access that, and that's available to the 31st of June. I think the supermarkets are Iceland and Tesco, I think. So that's when I said earlier, some of the offer will continue. The food support is the areas that will continue to be offered. So the letter that the government has sent out also advises that CEVs should be working from home where possible, but they can return to work from tomorrow. Yes, we can assume the 31st of June is a typo. So CEVs sorry, I've been thrown off a little bit there. CEVs advised to work from home where possible. They can return to work if they want, and they're no longer eligible for SSP or ESA if that's due to shielding. So if they've got that because of shielding, then they're no longer eligible for that. But the £20 universal credit will be extended until September 2021, and furloughs extended to the 30th of September. But that's between the employer and the employee to discuss. Again, the council will have nothing to do with that unless it's related to the universal credit. Education, students return to educational settings from tomorrow, and basic support councils will no longer receive any funding to deliver this support. But what they're saying is you can use the comp fund. However, we've still got quite a little bit of money in our CEV fund. So the idea is to use that until that's used up. So the free medical delivery service will stop today. And CEVs have got to ask family or friends to collect the medicines, or advised to visit pharmacies at a quieter time. And the volunteer responders will continue to provide support. So they're taking some things away, but they're also leaving some things in place for that longer period of time. So what are we going to do about it? So we've decided that at the moment we provide the same level of support to our vulnerable people as we do to CEVs. So it's a system whereby people phone in, they ask for this different support, which it could be food, it could be support with their mental well-being, it could be a range of things. And we've got a system in place where we will triage that support and signpost those needs to the providers, such as Live Well and other services within the council. So we are going to continue to provide that. We're going to leave that in place. And we're going to review the impact of that through our vulnerable people group to make sure that the third sector and the council services have all got capacity to continue to do it. We're going to mothball the NSS system, which is the website system, so that if we have to restart it, we can do so. It's a IT-based system, and we can just shut elements of that down and reactivate that as needed. And we're going to review our support at the end of June, but the intention is that we leave that support in place in line with Sam's roadmap, so that whatever we're doing in one area, we will continue to do in the contact centre and within our hubs and our food banks and our Live Well services. So we want to make sure we can offer support to our citizens that are vulnerable, irrespective of whether or not the CEVs or not. There is still a need out there, and we want to make sure that we can continue to fill that. We have got some funding to be able to do that. That's the intention. I think that's it in terms of CEVs. Has anyone any questions that they'd like to ask? No? All good. So we'll go to the next slide, please. So the government also announced at that time that they want councils to provide more practical support for those that are self-isolating. And the reason for that is that they want to make sure that people have got everything they need to enable them to self-isolate at home without the need to go out. So this comes into force tomorrow. And again, it's guidance that they've given the council to strengthen the support that the people may need if they've got to self-isolate. So again, the support, interestingly, is very similar to that offered to the CEVs. So it's access to food, befriending, wellbeing services, mental health support and prescription deliveries. But one of the big issues is the urgency of getting the support in place quickly, because what we don't want to happen is it goes through a process, we get a phone call, and then it's a number of days before that support's given. If you're self-isolating, you've been told to self-isolate for 10 days and you need support, you need it there and then, or you need it very quickly. So communication is a priority for us, and we're working with our comms team to look at how we improve the communications that's out there in terms of self-isolation, what to do, what not to do, what the rules. So we're confirming that today. But again, it's about making sure that people are more aware and raise that awareness. Financial support, they are saying they're giving us some financial support to be able to do this. And government released a press release, I think it was yesterday, that announced the amount that they were going to share. So I think for me, the cutting off the CEVs to be able to focus on the self-isolation in terms of what Wakefield's doing. So very similar, food access. So they want to provide food, like I said, where individuals are unable to rely on their friends. Again, wherever possible, food's got to be provided quickly to avoid breaking isolation rules, but it should be done in the most cost-effective way, and direct food should be the last resort. And again, those that are self-isolating will be enabled to access the DEFRA's non-shielding vulnerable scheme. That's the 2 supermarket scheme. But the problem with that is by the time they've logged on and got a slot, it may be too late. You may be 2 or 3 days into your 10-day self-isolation. So that's where we're working with our colleagues in Live Well and the hubs to make sure if they need food, we will get them food there. Another barrier that was identified to people actually self-isolating is that the essential tasks, so walking the dog. So the practical things like, walking the dog, it has been a real issue. So essentially, this is the package that they're putting in place. So help those who do not have alternative support networks. Support should be provided in the most cost-effective way, and we will be using our local volunteers sector to be able to do this. Signposting assistance to mental health, loneliness and practical support. So they're looking there at wellbeing, social contact, providing reassurance, check-ins, welfare calls. Social and digital inclusions, it's about how we support people to access services online. So for example, supermarket deliveries, and in the contact centre, we actually support people to actually log on, and we can log on for them and support them in that way. And again, mental health support, practical support, dog walking and helping with caring responsibilities. Because one of the issues is if you're ill and you've got 2 children at home, 2 young children, what support, how quickly can you get that support for those individuals? So next slide, please. So there are different routes for those self-isolating to seek support. So what we're doing it through enhanced communications. So that's making it clear how individuals can access support if they've no other means. So people choosing to contact the council at various points in their self-isolation journey. So again, that's how we assess their needs and provide the right support. And through the test and trace, so who are already making referrals to the council, for those who have already declared a support need. So those are the 3 or 4 channels that we see that people will come through. And again, we want to make sure one of the key things is making sure our website's up to date as well. So what are we doing? So our current vulnerable people's process is being reviewed and amended to make sure we capture all the requirements of those self-isolating. So we've changed our CRM system, we've changed our scripts, we've trained our staff, we've updated colleagues and members, we've had our vulnerable people's group to make sure that they can still continue to deliver the level of service that they're able to give at the moment. The data, we've had to review all our data and management information. So that's all been done in the last week or so. So a process has been agreed with our public health colleagues on how we share that data, because essentially the data will come into the test and trace team. they will then send the data to us via SharePoint, as simple as that, and we will then be able to, the contact centre will be able to act quickly. Then that's going to be done daily. So as the test and trace people get the data, 11 o'clock, it'll be in contact centre at 12 o'clock, and we'll start making those calls out to the people that need it. So then we will make those calls, we'll triage those calls and signpost them to where they need it. And what we want to do is review the process regularly through our vulnerable people group to make sure that the capacity is there to continue to deliver, and to be able to update each other on volumes and demand, because one of the things we found is with the CEVs, demand has been quite low. But again, what's been really useful is having the monthly vulnerable people group to make sure that everybody's got everything they need to deliver to the most vulnerable in our community. So communication and our vulnerable people group is going to be essential. And I think that's it from me, unless anybody's got any questions.
Thank you very much. I'm not sure if you can hear me or see me because I'm sharing the screen and I can't see you, but I don't know if there's any questions in the chat.
Yeah, there's a question. Yeah, can you see that, Pam?
Do you have more information about your vulnerable people group? How representative is this of the many needs of the community, and it's open for new people to join? That's from Jennifer. I can share our contacts, and yeah, the more people the better, to be honest. And again, so I can share our terms of reference, and more than happy for you to join our group. I can send that on through email.
Thank you. If you can send it to myself or Sarah, and that ties in nicely with the conversation that Anna and I have had with some people this morning. Right. Oh, yeah, I'll do that. Thank you ever so much, Pam. No, thank you. All right. So hopefully, if my screen's still on share, we've got some questions. And one of the questions that we've received earlier is that champions are sharing all sorts of communications and publicity from the council around COVID. And would it be possible for a little information to be shared on how PERDA might affect this, if indeed it does? So I'm going to ask my colleagues on the call, can anybody answer that, please? Maybe there's one for Kerry.
Hi, yeah, I'll answer that, Tracy. So PERDA is the period of time before elections when there are restrictions on what government, local government can put into the public domain. So to be really clear that we don't unduly influence the outcomes of any elections. So it really does guide some of the work that some of the local council officers do. In terms of the communications that champions share, that information is in the public domain. It's business as usual, which is allowed to continue during PERDA, and this is all approved by the communications team and the NHS communications team. So please do continue to share all of the information in the run up to the local election. What we would of course request is that we all remember the spirit of sharing the COVID community champions information, which is that it's there to improve people's health, so to keep politics out of it if you possibly can, when we're sharing that information, because it's the spirit of it is improving the health of the general population. So hopefully that answers that question. If anybody's got any more kind of specific questions, please could you email in, and I'm happy to have that conversation, because it does depend on, you know, what kind of organisation you come from.
Thank you, Kerry. And then a question that I think Tim put in the chat about the planning to open the beer garden in the community centre on the 12th of April, and any advice on opening the centre and their book swap would be very helpful.
Yeah, I'd probably for me to answer that one, I think what we would need to do, Tim, is to get a little bit more detail from you on that one, because it's around your COVID-19 risk assessments, looking at how many tables you're going to have laid out, and sort of like the proximity to each other. So there's quite a bit around that we probably just need a bit more information on, and just like really just to see how you've planned it out, so we can give you some guidance, and then we can point you towards government guidance that's out there that might be useful as well, that you can follow.
Thank you.
If you follow my email address that I've provided further up, we can, if you send the email to me, I'll make sure we can get that looked at.
Thank you. I think we've got Emma next, who's going to give us an update on the vaccine delivery.
Yeah, just a quick whistle stop. And Tracy, just on the back of that, are you going to mention to colleagues that we're thinking of doing a Q&A session for organisations that want to ask about sort of opening back up and risk assessments and things like that in the coming weeks?
Absolutely, Emma, thank you for that. Yeah, we've had a number of questions that have been posed by our COVID community champions on a similar vein. So we've decided to have a separate meeting that we can answer some of those questions. Now, it's been really difficult trying to find a slot in people's diaries. So what we have decided, hot off the press, is the next COVID champion meeting is on the 7th of April. So we will make this an extended one. So instead of the normal half-hour session, we'll increase it to an hour, and we'll invite people to come along to that to ask any questions. As normal, if anybody has any questions they would like to submit in advance to the panel, then please do so. And I understand that Sam, you'll be invited to that if you haven't already, if you're free, and Emma will be involved as well. An email will be going out hopefully today after this meeting to let everybody know and to invite them, but we thought we'd make best use of time with the meeting that we already had arranged.
Sorry, and as you say, if anyone could send their questions in advance, it would help us sort of shape the presentation on the day so we can kind of be most effective with the time we've got as well. That'd be helpful, and Sam's put the email address in there for those questions as well. My session today is going to keep it really short, really. Good news story for Wakefield is that now 58% of our entire Wakefield population have received their first dose of their COVID vaccination, and we're now almost at 20,000 people having received their second dose of vaccination, and that will continue to increase in the weeks ahead as we go through sort of repeat invitations for second doses, which is really, really good news. I think the other thing, we've had some good work from colleagues that are probably members of this group and partners across the Wakefield district in terms of supporting some vaccination sessions in one of our local mosques over the weekend, where we were able to use our roving vaccination model to deliver a vaccination clinic within the mosque setting, and where over 320 people attended that session. And as part of that, we were able to do women only sessions and men only sessions as well for that. So that was a real achievement for partners and probably colleagues on this call as well. And just a big thank you to everyone that helped with that. I think in the weeks ahead, I'll come back and do a bit more of a fact reminder around the COVID vaccine as we start to roll out to our younger age groups. I think it might be helpful for us to revisit some of the facts around vaccine safety, how the vaccine was produced, and other new sort of pieces of information that are coming through. So that's all from me today, Tracy. Thank you.
Thank you very much, everyone. So unless we've got any other questions, does anybody have a question they would like to ask? No, if not, all that remains then is to say thank you to everybody for joining us today. Thank you very much to Anna and Sam for talking about the roadmap, and Pam for telling us about the clinically extremely vulnerable and the shielding changes, and Emma for your update, and for Sarah for battling in the background with our IT and slides. Thank you everyone involved, and we look forward to seeing you next time.